Hello, I am Julie Riccio, a neonatologist at the University of Rochester Golisano Children's Hospital, and I will be sharing work done in collaboration with Dr. Megan Brunswick, a senior pediatric gastroenterology fellow at the University of Rochester. Some premature infants are unable to achieve full oral feedings at the time of discharge from the neonatal ICU and will therefore be discharged with home tube feedings. We're fortunate at the University of Rochester to have a pediatric advanced nutritional support team that can help guide these infants and families after discharge. The goal of this research project was to look back and compare characteristics of infants discharged with and without a feeding tube. We discovered that there are several characteristics of infants discharged with a feeding tube that differed from those infants not discharged with a feeding tube. These include lower gestational age and birth weight, the need for respiratory support, and the age at the time of the first oral feeding. This information helps us better understand which infants may require home tube feedings for supplemental nutritional needs at the time of discharge. Ultimately, earlier identification of these infants can lead to the establishment of discharge planning earlier in their hospital course and thus lead to earlier discharge. Additionally, we found that on average, infants require their feeding tubes at home after discharge for about 9 weeks. This information helps us guide families and provide anticipatory guidance for how long they can expect to be using their feeding tube once they are home. This is just one example of how Rochester research can help children reach their fullest potential.